world and fellow YouTubers. My name is Fiona, and I have decided to start a YouTube channel about Lyme's disease and what it's like to have it, and kind of just document what happened to me, and also give people that are either have family that have Lyme disease, if they have Lyme's disease themselves, an insight to what Lyme's disease kind of is, how it affects a person's life. And just other details like co-infections, which is a hot topic and often the reason why Lyme's disease gets misunderstood and confused and has such a plethora of different symptoms to them. But I don't want to get too much into the crazy details of all that kind of stuff yet today. Today I just wanted to kind of introduce myself and just let you know kind of where I'm at and get started on showing you guys how I do my IV infusions at home currently for the Lyme's disease treatment. Like I previously mentioned, I do have other co-infections, which also have resulted in different IV medications. I currently am taking IV Septra for something called Babesia as well. Oh, that's my puppy, sorry. Anyways, so I lose my train of thought really easily. A big thing to really keep in mind here is that I had Lyme's disease for 6 years now, going on 7. It went undiagnosed for a significantly long portion of time because of the lack of knowledge that exists within our current medical system about Lyme's disease, and because the CDC testing is not accurate and doesn't pick up on a lot of Lyme's disease issues and co-infections and just different strains of it. It's really complicated. Again, I'm not going to go into details about that yet. But long story short, I didn't get diagnosed. They didn't figure it out. I saw something with Dr. Horowitz online on YouTube, and everything he said was laid out so well that it really connected with me, and I found a doctor in my area, Dr. Susan Mara, who did all the testing and figured it all out in the end for me and pretty much saved my life. So big thing is, if you have Lyme's disease, you need to make sure you go to a Lyme literate doctor, because you could go to other doctors and they'll tell you you're fine as a day, but the truth of the matter is you could be extremely sick. And because that happened to me, it ended up spreading to my brain. I started developing symptoms like Alzheimer's and dementia issues. Also, it evolved into like seeming like I was psychologically crazy or something. I was like hallucinating, seeing colors and spots, and I can't even explain it to you, but it's been something that I wouldn't wish on my worst enemy. But anyways, that's partly why I want to shed some light on this subject, is because there's a lot of people out there that get misdiagnosed, like with things like fibromyalgia. I'm not a medical trained professional. I'm only somebody that's been on a pretty big journey that has exposed me to hundreds of doctors and many different disciplines and medical practices. And in all of that experience, the big takeaway for me is that you always got to be your own advocate. You got to look out for yourself, and you got to always double check and keep yourself educated. The sad thing is if you don't have a support system and people to do that for you and to help you, the chances of you probably figuring out your diagnosis and getting the accurate help are very slim. Because like I said, it propagates into like depression, like seeming like you have really bad depression. It can, be like you're kind of crazy, and a lot of times they'll get too focused on that. I've had like everything under the sun going on, which has also been a big issue. But anyways, sorry, I'm going off into a tangent. Don't want to do that. Just kind of wanted to introduce myself and let you know, hey, and hopefully I can help shed some light to people that do have Lyme's disease and other co-infections, because you could not have Lyme's disease but have some of the co-infections, like Bartonella, and I know somebody who's got Bartonella but not Lyme's, And actually one of my doctors too had that, and she lost her eyesight from it. That's another tick-borne illness. Chances are when you get Lyme's disease, you are going to contract another type of co-infection, and if that doesn't get properly checked for and diagnosed, you won't ever get better. And a lot of people don't understand what chronic Lyme's disease is. I didn't at first. My doctor that I adore, he said, I remember him saying to me once when we were really having a hard time figuring it out, he said, you wouldn't laugh if it was chronic Lyme's disease. And then I thought to myself, how in the world do you get chronic Lyme's disease? What is chronic Lyme's disease? You know, like, and then it happened. So what chronic Lyme's disease is that if they don't catch it right away, it spreads so much into your body and it becomes something that is unmanageable to the point where it becomes a chronic problem, and you're chronically having to treat it and chronically having to deal with it. And especially like because mine has spread up into my brain now, so that's why I've started IV medications. So hopefully if somebody out there has family members that are on IV meds, or family members that don't know what to do, or any situation, even somebody with Lyme, or just if you're curious, I just want to open up your eyes, even if you're a healthcare professional, I want to open up your eyes to the inside world of what I deal with and what's going on in my life and what's happening, because I know that a lot of people don't understand, and they don't get it, and they don't realize how bad it is. And if I didn't have the support of my family, I would not be able to get treatment because of the costs of everything involved. And unfortunately, that's the reality of the situation for a lot of people. And I don't think that it's right that that is the reality for a lot of people. People should be a right to get medical treatment. Nobody should lose their entire life due to a disease because they can't get treatment and they can't afford it. We live in America. This shouldn't happen. Anyways, another topic. So, because it's moved to my brain, they had to put a PICC line in. I was obviously oblivious to what this was, but I kind of wanted to explain that to you before I do the whole IV portion, because that's how the IV meds get put into my body. So, I'm just going to start with this video with an intro and explaining kind of what a PICC line is. So I tried to do this. I hope you guys can see it. Sorry, I'm just starting YouTube. I'll get better with all the technology and stuff like that in just a bit here. But this was the quickest Jimmy Riggin way I could do it for you. So if you look right here, you can kind of see this is where the PICC line is, and it goes up through the arm and into the main vein that goes into the heart. And by doing that, what it does is the medication gets pumped right into your heart, into the main area where all of the blood goes from there out. And so by doing that, it allows us to get the medication up past the blood-brain barrier to the brain faster. Like if you did oral medications, you wouldn't get past the blood-brain barrier. So this is the way that they handle that. And if your Lyme's disease spreads to that point, and sadly you need to have IV medication, this is what usually happens. So they started me off with a PICC line. PICC lines aren't meant to be for a long period of time, so I'm probably going to get a port put in eventually, but we'll go over that now. We'll go over that another day completely. But now I started out my journey with my PICC line. So what my PICC line is it's this guy right here. I have an extension on it so that I can do my own infusions. And then, sorry, my bandage is due for a change. My nurse is coming tomorrow, so forgive the messiness. I'll do another view of it and kind of go over that more once I have a cleaner, more pretty bandage. But that's my PICC line right there. And like I said, it goes all the way up, doop, 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 and right into here. And all over my body, into my brain to get me better. So, what I'm going to do is, I'm going to do a part 2 for this video where I'm actually going to get set up and show you all my infusion stuff and what I do. Thanks for listening so far, guys, and stay tuned for the next part 2. Adios!